Let's conclude the show today with a very important discussion, a discussion that concerns you and I, how we sit and its impact on our health and how we can really deal with it. We've been joined in the studio by one lady and two gentlemen who really know about spine and will help us know how to keep our spine healthy. So I have in the studio Melissa Erickson. She's a member of the 33 Spine Align and an associate professor of orthopedic surgery at Duke University. Hi, good morning to you.
Good morning.
Thanks for coming.
Thanks for having us.
Great. Rory Godwin is also a member of the 33 Spine Align and as well an associate professor of neurosurgery at Duke University.
Yes, good morning.
Rory, good morning. And Dr. Kwajo Yankee, neurosurgery at FOCOS Hospital. Hi.
Hello.
Hope all is well.
Everything.
Rory, let me start with you. When we say 33 Spine Align, what is it?
So 33 Spinal Line, it's our nonprofit organization that really is focused on delivering care in Africa overall. So, you know, we started in 2018 and we basically have raised money to sponsor children to come to FOCOS Hospital and get surgeries literally for, you know, some of the most severe scoliosis or back problems that, you know, this continent faces. We decided to do it around the December time because we wanted to, you know, give back in terms of the Christmas giving and make sure that, you know, we could give these kids a new spine, so to speak, a new walk on life. Try to change the way that kind of healthcare is delivered as well.
So you are here for that?
Yes, specifically.
So free surgeries are going to happen at FOCOS?
Yeah. This past week we did 6 or 7 of the, we did 7 surgeries this week, and then we just eclipsed our 50 patient mark. So, you know, the goal is to try to get some additional sponsors and try to raise more money so that way we can help more kids. Yeah.
Oh, and this is the first time I'm hearing about it.
Yeah.
I have to note it down. Next Christmas, we need to follow it up.
Yeah.
But Melissa, I mean, why is it important for us to keep our spine healthy?
So the spine is actually the connection to the rest of your body. So it's the main support structure, and it's incredibly important because it connects your head to your arms, to your legs, but it also protects the spinal cord and all the nerve roots that allows us to feel everything, for us to keep walking and to keep active. And all of us know someone who's had debilitating back pain or some type of spine problem. So it's important to just maintain that health so that we could keep active and spending time with people that we love.
Okay, all right. So it's important you do, but how do I do it? How do I ensure I'm keeping my spine healthy?
It's a great question. So a lot of times we hear about people losing their mobility, they get stiff. You asked previously about lifting things, and it's so important that we take care of our spines, and we can do that by eating healthy, limiting our processed foods, making sure that we get out and move a little bit every day. If you are going to lift, make sure that you're lifting with proper technique, bending through your hips, bending your knees, as opposed to putting a lot of strain on your back. And also just understanding when is this run-of-the-mill back pain versus this is something I need to seek care to make sure there's not somebody who can help me get over this back pain, or make sure that it's not something more serious that shouldn't be ignored.
Okay. So, Kwajo, you've been around for this country and taking care of people. What are the most common spine problems you see in this country and by extension, the African continent?
Thank you very much. So we do see quite a lot of spine problems. Like she rightly said, sometimes it's from the way our posturing or the activities that we do. Majority of the time, we see a lot of patients who come with low back pain. So low back pain going down the lower limbs, patients who cannot walk too far. Patients also come in with neck pain and then pain down the upper extremities. So these are things which are affecting the spine, spinal cord, and then the nerves. We also do see patients who come in what we call herniated discs. Maybe someone lifted a heavy load, didn't lift it properly, and then they get a disc which is herniated.
Herniated means what? Shifted or something?
Sorry. So in between the bones of the spine, we have what we call a disc, like a cushion.
Yeah.
And if the cushion can just push out and then go and sit on the nerve or the spinal cord, and it can have, it can make you develop weakness in your lower limbs or have a lot of pain down the lower limbs, and even the upper extremity also.
Okay.
We also see patients who come in with, I've mentioned, okay, like you rightly said, we see patients who have scoliosis. These are young, typically young patients who develop a curve at their backs. Yeah, we see these patients also. So neck pain, low back pain, pain down the lower limbs, difficulty walking. All these things come from the spine.
But aside the lifting, for example, and our certain posture, are there conditions that predispose people to spine challenges?
For sure. I must say that a lot of, okay, so we can group them into patients who are younger and then older patients. So a lot of the problems we see in older patients are actually from what we call degenerative disease, so like wear and tear. Like you're wearing slippers, at some point it will wear out. The same thing happens at the back. So you are using the bones at the back, you are bending, you are sitting for a long time. By the time you get to 60, 70, things will begin to wear out.
Okay.
And when these things wear out, yes, you begin to have some amount of low back pain. And then you may, if it's sitting on the nerve or the disc is sitting on it, you may have pain going down the lower limbs. But these are for older patients. For much younger patients, so we see a lot in the professionals. People are sitting for long periods. Some people go to work, they sit from morning till evening without even getting up.
Yeah.
You are putting a lot of load at the back. So you need to take breaks in between. And it's rightly said, bending to lift, you have to lift properly. Of course, trauma, that can be from accidental injuries. Yeah.
And even things, I was just going to say, and even things like being at your computer and bending over and your neck, like those little things can make a big difference in terms of your overall.
So the best way to do it is to do
sit up and
That'll be difficult for a lot of us to do.
Yeah.
Anyway.
Well, not all the time. Just,
But Kojo, like they say, sometimes when you talk about diseases, some will say when you eat ABC, it could help you. Do we have that for spine health as well?
Okay, so generally, I mean, in our part of the world, we are lucky. A lot of the foods we have around, they are generally good for the bones and then the discs at the back. So foods which are good for the bones, like we have milk, we have fish which contains bones generally, whether it's salmon or fish with bones, they are good. Okay. Our green leafy vegetables, they are high in calcium. So these are things that we need to actually take in. I mentioned milk already, yogurt, all these things are very good in calcium. And then you need proteins. I'm sure we know about proteins, eggs, all the meat, all of these things. So you need all these things. And then we need to encourage our people to get exposed to the sun for some vitamin D. Okay. Yes. Okay. Apart from that, magnesium, potassium, we have fruits. Bananas are rich in potassium, magnesium. Plantains are very rich also in potassium. Generally, the foods we have, we are very lucky. All these things are very good for our spine health. What you have to try to avoid is the processed foods. Okay. I mean, these are not too good for us. Yeah.
So it shouldn't be your go-to every day.
Yeah.
Rory, I mean, you are coming from the States, and we know that you have access to very good, experts and even facilities. But in Ghana, from what you know, if I have a spine problem, where do you think I should go to?
Well, I may be biased, but I think you have one of the world's best centers here in Ghana at FOCOS Hospital. It's one of the places that you can receive all of your orthopedic care just in general. And so if you have a spine problem, you can be treated by world-class surgeons here. I think a testament to that is the fact that you have several surgeons that come from the United States and go there regularly to participate in surgeries, to learn, to teach. And I think that there's a wonderful exchange of information at that hospital. So I think any patient that's in the Ghana area, just in general, or even West Africa, I think is very lucky to have that hospital as one of the primary places where it could go to kind of get their spine care. I mean, I don't know, Dr. Yankee, I don't know if you want to share the phone number.
And again, if they say FOCOS is the best, where are you located?
Yeah. We are located at Oyarifa.
Okay.
Yeah, so it's at Oyarifa, close to Pantan Hospital.
Okay. Okay.
I think once you Google,
you will know. Yeah. Okay. All right. So there, you have where you should be when you have issues with your spine. Melissa, let me come to you. I mean, what can Ghanaians do to help take care of their spine?
I think the biggest thing would be make sure that you're moving regularly. Take time to stretch. Stretch a little bit every day to maintain your flexibility. Eat well. And then whenever you're working, if you could try to do something so that everything's at eye level as opposed to being bent down or really spending a lot of time looking up. A lot of us are using our phones and we spend a lot of time like this. All of that can wear on your spine.
Okay.
So just practicing good habits of trying to do everything so it's right at the level of your eyes and you're not straining. And then get up, change positions, stretch a little. It's good to do some cardiovascular exercise, about 150 minutes total in a week, and then some light lifting just to make sure that you keep your bones healthy and strong.
But let me ask you a question. Myself, the two Kojos, you see, the way we said, we've leaned onto our side, but you have sat straight all throughout.
That's only because I'm on camera.
No, but, okay. Because I was going to ask whether we are predisposed to sitting in a certain way or what.
Yeah.
Because I see the two of you sit straight. By myself and Kojo, we have to be leaning on our side and what have you. I don't know whether the geographical area you find yourself also plays a role on how you sit or whatever.
Well, one of the things I think that we have the luxury of is that we treat a lot of these diseases. So we see what happens when people don't take care of themselves as much. And so I think it becomes a little bit easier for us to say, hey, let's, for instance, sitting up straight is something that's usually very hard for me, but I think it's super important. I have friends who make fun of me because I am not the most flexible person. But because of that, I try to, stretch and I try to do those things because I realize that there's, it could be much worse. And when you get to the point where you can't move, when you can't do the things that you want to do anymore, I think that's when, you'll realize that, wow, I should have been doing this the whole time. So.
Okay, all right. It's been a good time talking to you, but probably you have messages you want to leave with our audience. Let me start with you, Rory. What do you want to leave Ghanaians?
Yeah, I think, I'll talk from the 33 spinal line part. I think that, one of the things we just want local Ghanaians to know is that, we are here to try to improve spine care just all across the continent. And so we just hope that we can provide services and, give gifts to kids that otherwise needs new spines. So.
Just before, someone who's watching says, Kojo, the truth is, you go to chiropractors, they take you through a series of processes and charge you at every point. It makes it very expensive and unattractive. How do you answer this? How do you address this?
Okay, I would say that at some point, when you do have low back pain, majority of the time, the low back pain we have, probably 80 to 90% of the time, they will go away even without doing anything. In a lot of people, the low back pain becomes important or becomes significant that you need attention when, let's say, it's persistent for over 4 weeks, you're still not getting some relief, or you've taken some over-the-counter medication, you're not getting relief, or if you have pain going down the legs, you can't walk too far, or it's associated with some urinary problems, toilet problems. Those ones you really need a lot of attention. I can't talk about any other person's job. Okay. I'm not too sure exactly what the
issues are.
What I would say is that if you do have a problem with your spine, you need to get to get professional attention. You don't have to sit on it for too long. Otherwise, sometimes you may come in too late.
Okay. Yeah. Dr. Melissa, one important question.
Yes.
Do massages deal with spine issues? Or let's say I have a back pain and I think I have to go for massage. You can correct me.
I think that massage is always a good thing. I don't think anyone should turn down massages, and I love getting a massage. I think more importantly, the reason that you're going for a massage is to give your body some rest. And as the person had mentioned, it can be expensive if you're always relying on going into a chiropractor. So learning about spine education and making sure that you do the same exercises that you learn in physical therapy or in a chiropractor's office, or even massage, right? Yeah. Some of that is stretching and learning, like, listen to your body when my back is sore. How do I make sure that it's that temporary pain as opposed to that persistent pain? Okay. So massage can definitely help. Okay. Regularly schedule it and treat yourself.
Yeah. I think I was just going to say, I think about the behaviors and just putting yourself in to prevent it from getting worse.
Okay, thank you very much. Kojo, you have a last word to give our viewers?
Okay. Well, my last word is that, like I mentioned before, just listen to your body, pay attention to your spine. If you do have problems, seek professional advice. Okay.
All right. Thank you very much for coming in. So I was joined by Melissa Erickson, a member of the 33 Spinal Line, Associate Professor of Orthopedic Surgery at Duke University. Rory Godwin is a member of the 33 Spinal Line, an Associate Professor of Neurosurgery at Duke University. And then Kojo Nyanki at Neurosurgery, FOCOS Hospital. Please do think about establishing one like that in Ahanta West. I don't know if you know Ahanta West.
I do.
I'll get you a land if that's what you need. One of the chiefs will get you a land. Just make sure you have one of such hospital in Ahanta West and reduce the cost for us because we are giving you free land.
You buy it,
I don't have a problem. Okay, this is on-screen negotiation. We've done it, right?
I like it.
Great. Okay, thank you very much for coming. But before we take a leave of you, let me remind you that the Adum TV, Joy FM, in partnership with a poultry farm, we've come up with the Xmas Egg Market. We say buy fresh eggs at unbeatable farm gate prices from Friday 19th December, which is tomorrow, to Saturday 20th December, 8 a.m. to 5 p.m. daily at the Joy FM car park. So just come here and buy your fresh eggs at farm gate prices. Very, very cheap. Come around and get some of the eggs for Christmas. 8 a.m. to 5 p.m. daily from tomorrow to Saturday. So make it a point to be here to buy that. We say don't miss out. Come early and buy more for Christmas and beyond. This is what the Multimedia Group is offering you this Christmas. Thank you very much, gentlemen and lady, for coming. And thank you for watching. We'll have a date again some other time. But now, the Joy business is reviewing the most important stories that came up within this year. From the appointment of the finance minister, appointment of the governor of the Bank of Ghana, to other important decisions and policies that the government has taken in respect of managing the economy. Winston Amwa is hosting a panel, and we are bringing that to you live here on the Joy News channel. So do enjoy that one, and we'll meet again, God willing, tomorrow. Until then, please be good.